तो लाइव वो स्टार्ट कर देते हैं एक बार साथ सब। यूआरएल मैं आपको देता हूँ सर फोन पे।
यूआरएल मैंने खोल लिया, मैंने आपका ढूंढ लिया था डैम्स के चैनल पे ना। डन।
So good evening all of you. Welcome to this INICET recall of the November 2024 session for the subject of PSM. Me and my friend and colleague Dr. Kashish are here to take you through this journey of PSM, where we had 17 questions this time. 12 questions were core PSM and 5 questions were an overlap with other subjects. In the core PSM, epidemiology was at 2 questions, whereas health programs was the major focus this time. Questions were moderate, except for a couple of questions where it was just about reading the options properly. Over to Dr. Kashish for the first round of questions, where he would be discussing on the important topics of epidemiology and screening of disease, vaccines, and infectious disease. Over to you, Dr. Kashish.
Hi everyone, this is Dr. Kashish Grover, your PSM faculty. So now we are going to discuss the INICET questions, and these are the recall-based questions. So there are some options which I need your help also in recalling it. And I'm thankful to Dr. Sidharth, my friend Dr. Sidharth Mishra. He beautifully arranged everything, and now we'll be starting. The first question is from chapter epidemiology. So guys, this chapter is asking, this question is asking about the sequence, the correct sequence. This question is asking about the correct sequence of RCT. So guys, in RCT, the number one thing what we do is, so we have a whole population, we choose a study population. Then from that study population, so we have a whole population, we choose a study population. In this process, we do random sampling. Then when we have a study population, we divide them in 2 groups or 3 groups or 4 groups, depending upon which, how many number of arms do we need in RCT. Usually we do 2, right? So now we have to divide it in 2 groups, right? Now this process is known as randomization. This process is known as randomization. Now, when I'm choosing the study population, we have some inclusion exclusion criteria. We have some inclusion exclusion criteria. For example, very sick patient, I'm not going to include in my study. So I have some inclusion criteria that the person should be hypertensive. The person should be hypertensive. For example, if I'm doing the study. So number one thing is we choose study population, and we have some inclusion and exclusion criteria. So here the point number 3 is the one which I'm going to do first. Then we do the randomization. We divide them. What is randomization? Randomization is allocating the study subjects. We divide in 2 groups. So then we do randomization. After that, we do blinding. After that, we do blinding. A quick recall, a quick recap. The blinding is of 3 types: single blinding, double blinding, and triple blinding. Single blinding, double blinding, and triple blinding, right? So after that, we do statistical analysis. So here the correct sequence is option 3, option 1, option 2, and option 4. Now, coming to the best evidence, guys, whenever they ask you the best evidence in the hierarchy, it is always meta-analysis. So the best evidence is always meta-analysis. This is purely INICET pattern questions. So last 3, 4, 5 years, we used to see this kind of question. Even older than 3, 4, 5 year also, we used to see these kind of questions. I want to repeat it. Best level in the hierarchy is meta-analysis. Best study design for the causal relationship, right? Between what? Exposure and outcome, RCT, right? Exposure and outcome. If we want to do so, the best for causal is RCT. Now, for then we have case control and cohort. So case control study is best. It is best when when the disease is rare. When the disease is rare, then case control is the best. And when the exposure is rare, in that case, the best is cohort study. In that case, the best is cohort study. Now, so here the correct answer is meta-analysis. Now, few questions from the topic screening. So many students, they were confused in this. Guys, listen. When you are screening everyone in the village, this is mass screening. When you are selecting a particular group, when you are selecting a particular group, so here we are selecting family members of hypertensive and diabetic patients. So this is not mass screening, because here we are not screening everyone in the village, but some selected person in the village. So here the best answer is selective. Here the best answer is selective. Now, so now coming to infectious diseases, very easy question. I think this is the easiest question in the whole INICET paper. Water-based diseases, hepatitis A, rest hepatitis B, hepatitis C, they are blood-borne. They are blood-borne. So here, I think this is the easiest question. And my friend Dr. Sidharth, he would also agree that this was the easiest question from my chapter. Okay, now, second easiest, COVID-19. So PSM in AIMS is typically unpredictable. And this time they have asked COVID-19 control. Guys, cough etiquette, mask, vaccine is there, but ivermectin, no, ivermectin is not used for control of COVID-19. So here the best answer is option C. Ivermectin is not used. Now we have some question on vaccine. Guys, this is a repeat question. This is a repeat question. And the vaccine, hepatitis B is not a live vaccine. It is not a live vaccine. It is a recombinant vaccine. So here we have rotavirus. Yes, rotavirus is we have live vaccine. Measles is live. Varicella is also live. Can anyone write in the chat box the strain of varicella? Yes. Dr. Rushikesh, bache, they mentioned, I do agree. But if they have mentioned that they are, see, do not see what they have mentioned. Just focus on what study population they want to include. If they want to include the family members of hypertensives, right? Even if they have mentioned that the area is having high cases, doesn't matter. But focus on your study population. So there they are including only family members. So bache, that is why the answer will be selective. Good, Roma. Good, very good. Oka strain is a live vaccine. It is a live varicella vaccine. Yes. Now coming to next question, question number 7. Here the strain is Oka. This is important. Guys, I want your help here. Some students are saying vaccine not given in more than 65 years. Some students are saying vaccine given in more than 65 years. Guys, listen. I want to end the whole controversy here. I need your help. Please help me. What was the question? Vaccine not giving more than 65 years or vaccine given in more than 65 years? These two are totally poles apart different questions. I want to end this controversy. Why? Because this adult immunization is a repeat question in INICET. INICET 2021, there was the same question. But this time they have twisted it and they have particular, guys, adult immunization is the guidelines is laid by CDC. And the CDC gives guideline. Here in India, we accept the guideline, and in the physicians, API. So the physicians in India, they recommend then the vaccine. So if I not given was there, all right, the vaccine not given was there. All right. So guys, if I talk about the vaccine not given was there, then the answer here will be HPV also in more than 65 years we don't give. Varicella, it is not. Okay, I'll tell you everything. So guys, the CDC says that the elderly population, the CDC says that the elderly population given some vaccines. Now, one thing is, irrespective of any medical condition, you give it to every more than 65 year. Second thing is, more than 65 year, but not given to everyone. So if there is a person who is more than 65 year, irrespective of any medical condition, the vaccines which are given, the name of the vaccine is, I'm writing here, please note down, irrespective of any medical condition, given to all more than 65 year, right? So number one is TD. Number one is TD, right? Number two is COVID vaccine. COVID vaccine, TD, it is given to more than influenza. Third is influenza. Fourth is shingles. Fourth is shingles, right? So here the fourth is shingles and fifth is pneumococcal. These 5 vaccines are given to every more than 65 year. These are recommended, right? These are recommended. So more than 65 year should take it, right? Now, vaccines not given at all to more than 65 year, the vaccines are chickenpox, HPV, not given at all. Chickenpox, HPV. These are not given at all. Other vaccines like MMR, Hep A. So 2 vaccines which are not given at all. This is chickenpox, HPV. So depending upon, yes. Roma, bache, influenza. Yes, influenza is given to every elderly irrespective of medical conditions. If other vaccines like hepatitis A, MMR, they are given when we see the person is very high risk, right? So here, if the answer was more than 65 year, not given at all, we don't give chickenpox to more than 65 year. HPV, human papilloma, is also not given. I hope, guys, the confusion is clear here, right? So we got the options like the vaccine given. Can I go ahead? Can I go ahead? All right. So now I would like to invite my colleague, my friend, Dr. Sidharth, for the discussion of rest of the questions.
Okay, guys. So thank you, Dr. Kashish. Now we will be continuing further. Question number 8, not passive immunity is. So this was an overlap question with microbiology, which Surya sir would be discussing in detail today. Yes, for us, toxoid does not provide you passive immunity. Okay, because toxoids are basically you are giving it in the form of an active one. Yes. So I'll leave it to Surya sir. My topic of discussion comes from the question number 9. Anemia Mukt Bharat, not a strategy is. If you open your class notes, classically we teach you a 6 into 6 into 6 strategy. In this 6 into 6 into 6 strategy, we have 6 interventions, we have 6 beneficiary groups, and we have 6 institutional mechanisms. And if you have attended the class, I always say that 6 institutional mechanism details are not important, but we do read in detail the 6 interventions and the 6 beneficiary groups. So the answer to this question was 6 health functionaries, option number 4. Question number 10. Again, a classic INICET question, a repeat question. Again, we have discussed in the HIV sentinel surveillance. In the HIV sentinel surveillance, guys, we divide into 3 different groups. One is the high-risk group. This high-risk group would come in contact with the bridge population, will come in contact with the general population. The general population is typically indicated by the ANC females. The bridge population, we have single migrant men and the long distance truck drivers. High risk group, we have commercial sex worker, intravenous drug users, men having sex with men, and the transgenders. So these are the 4 classic things which comes over here. Not high risk group, truck drivers, because the truck drivers are the bridge population. Yes, guys. Uncomplicated malaria, which is not used it. Yes. Now, again, we should understand that this was again an overlap question with pharma. Now, guys, there is a slight confusion over here. There are some students who are saying that in the question, falciparum was given, vivax was given. See, if they classically say falciparum, in a falciparum case, we cannot use chloroquine. Yes. So there is a doubt in this question. Even I've discussed this with Thiru sir and Dinesh sir. There is a slight recall issue. You can just let us know what was the final question. Okay. Which of the following is not done by health worker for malaria diagnosis? Now the question actually changed. It was actually which of the following is done by the health worker for malaria diagnosis. I just got it last moment. Diagnosis. Now see guys, please understand that diagnosis is done by the rapid diagnostic test kit. That is the HRP2 antigen. The health worker male does collect the thick and thin smears, will do the MP slide, will use the thick and thick smear. But for diagnosis, we are using ICT, that is the rapid diagnostic test with the HRP2 antigen. Yes, that okay, Roma, okay, MBBS hacks, we get it. No falciparum was given. Yes, see, uncomplicated malaria not used. If you ask me as a PSM person, then my answer will change, because we do give primaquine, especially when we have vivax. We do give chloroquine if it is a vivax, because uncomplicated malaria will be generally vivax with these two. If it is a falciparum, we will use artemether. If it is a falciparum in other states, we will be using sulfadoxine pyrimethamine. So probably the pharma faculties are better equipped to answer you this then, if it is not as I mentioned. Yes. Preventive obstetrics and pediatrics. Which of the following is not included in the criteria of SAM? SAM, low weight for height, yes. Pedal edema, yes. Mid-arm circumference, less than 11.5 centimeter is an indication of SAM. Yes. Low height for age. This talks about chronic malnutrition. Chronic malnutrition. Yes, guys. Harsh, field setting malaria, no problem. Even if it is field setting malaria. But if they are talking about diagnosis, it has to be a rapid antigen test. See, the health worker male does take sample for thick and thin smear, but it cannot be used for diagnosis by the health worker. It has to go to the lab. Okay, guys? Done? Now, hospital waste management, pus swab, cotton is yellow. Any infective secretion, yellow. Guys, was, yes, HRP2, it's an ICT kit. You will have a small kit, a white color kit. That kit, yes, Harsh, the kit will help you. The kit picks up HRP2 antigen. Okay. Copper T, was there a question over here? Because some people were saying yes, some people were saying no. So copper T question, was it there in the exam? Was it there in the exam? Yes, guys, copper T question, was it there in the exam? Okay, so we cross it. No problem, medical field setting, no problem. There is no other way. You cannot do an MP slide. You need a microscope here. You need a microscope. So without a microscope, you would not be able to do it. Yes, I hope you get it. Done. No problem. I've cut the copper T question. Now, limitation of universal health coverage in a country. See, universal health coverage, every person should get healthcare. This was more of a common sense based question. UHC requires high capital, so it is difficult to implement in rural area of any country. Yes, seems to be true. Okay. Challenge is to provide quality in a resource limited setting. Yes, definitely. Healthcare should be free for cost for everyone, irrespective of financial status. No. See, guys, our health system is based on equitability. When we talk about equitability, we actually divide the programs. That's the reason JSYS, low performing, high performing. Majority of our health programs is mainly for below poverty line. Ayushman Bharat caters to roughly 50% of population, where 40% are below poverty line. Okay, so that's how they work it out. Option D, I could not get it. So if anyone remembers the option D, do let us know. So out of the three options, option C looks as the best answer. Okay. INICET is used in Yes, answer was cost-effective analysis. Now, what is ICER? It is incremental. It is incremental cost effectiveness ratio. Now, the name itself tells you cost effectiveness. So the answer to this question was cost effective analysis. Now, guys, why is this done? So basically, we see that when we put an input of cost, how better an output we get. So more the ICER, better will be your outcome. Yes, guys. So these were some of the questions which we could recollect. 12 questions were from PSM, 5 were an overlap. There is still some doubts with the questions. Do not worry. Whatever AIMS takes, then the answer is the final answer. Yes, guys. If you do recollect the options, do drop me a WhatsApp at 9968859773. That's all from the side of me and Dr. Kashish. Remember, at the end of the day, it does not matter what answer you think or what I think. What matters is what the INICET people think, which we don't know. But these questions are mainly meant to give you an idea on the type of questions which can be asked in the exam. So keep smiling, guys. Put up your head high and see you. Bye-bye. Take care.